Hi everyone, welcome back. Thank you so much for joining us. Today we're joined by Mikelle Moore, our Senior Vice President, Chief Community Health Officer, who oversees Intermountain's aim to improve community conditions throughout our service areas. Mikelle, thank you so much for joining us.
Thank you, Amanda.
We really appreciate it. So COVID-19 is difficult for a lot of people, but especially for our vulnerable populations. How is Intermountain helping our homeless communities and our other communities to stay safe and protected?
First, you're right. There's a lot of emerging evidence that people in lower socioeconomic status and different living conditions, poorer living conditions, are experiencing COVID-19 in much greater severity than other communities. And we are seeing that here in Utah as well. And it started really with becoming aware that our homeless friends were having as you might imagine, just a really difficult time getting tested, coming in to get tested, and then waiting for results for some period of time before, and not having a place to stay, isolated and separate from others that they interact with. And so we've been working with community partners to change a lot of things about the way we're working and supporting homeless communities in different ways. So when we bring when a homeless individual comes to one of our hospitals for care and ends up getting tested, we're providing a warm meal, encouraging them to stay for that test, allowing someone from one of the homeless resource centers to come with them, which required us to think about our visitation policies so that we can help them feel comfortable and safe during that time that they're getting tested. We're also, when we discharge, making sure that they leave with a 14-day supply of medication, because they're often not able to access medications on weekends or nights and get what they need to stay safe. We're also really making sure that we're assessing behavioral health needs, substance use issues, and other things when we're seeing someone for COVID-19 conditions, because a lot of our homeless community also have behavioral health concerns just based on the life that they're experiencing. So we're trying to be holistic in the way that we're thinking about things.
So when someone does get tested who is in that homeless population, you said they're staying for the duration of when they get the results. Is that in the hospitals that they're typically staying, or does it depend on the situation?
It depends on the situation and where we have, initially we were having people stay until we could get them results or have a plan for where they could isolate until they got results. We've had great collaboration with our various counties who have now stood up quarantine and isolation sites. So now it's more a matter of coordinating. Let's make sure this individual has a plan for where they're going to quarantine or isolate, and that we're able to ensure we can communicate with them when we get results. Oftentimes someone may not have a way for us to reach them, so we're making sure that the homeless service provider has a way to connect with them and keep them informed until we have results.
Yeah, that's probably something a lot of people don't think about, is they know they can get results by a phone call or email. So it's great to hear that we're kind of working with our community partners on that.
Yeah.
And also, how is Intermountain partnering with some of our community organizations, including our homeless resources, to make sure that the coordination is happening behind the scenes?
So there's lots of different ways, and we've been trying to proactively reach to our community partners to say, what are you seeing about what people are needing in our community, and how can Intermountain be responsive? So, for example, 4th Street Clinic, which is one of the homeless clinic providers in our state, has had a need for additional staff. They've had staff out sick and just don't have the depth that Intermountain does. So we've been able to deploy some caregivers to 4th Street Clinic, actually just loaning them some of our staff to help work with specific populations like children. There's a lot of children that 4th Street Clinic serves, and so Primary Children's has provided some resources, and we're really happy to do that. We've also, the homeless resource centers here in Salt Lake have had some outbreaks. They've had some homeless individuals become sick, get tested positive for COVID-19, and then have concern that the exposure may have already occurred throughout the entire resource center. So we have sent teams, actually our Intermountain nurse leaders did a great job partnering with the University of Utah and the state public health team to go into the homeless resource centers and test all of the homeless in those resource centers just a couple of days ago so that we could be sure we knew who had COVID-19 and isolate them appropriately. We've also been repurposing some of our equipment. So our Heredogene testing RV had been equipped to collect samples for the Heredogene study. We've re-outfitted that to be a COVID-19 testing vehicle, and that vehicle is going out to some communities to perform testing, where it just doesn't make sense to bring people in to get tested, or where we need to do a large swath of testing in the community.
Yeah, and that mobile testing site I know is starting this weekend in Park City. We're going to be releasing a little bit more details about that later, so people can look out for that. But the aim is to reach those underserved populations that don't necessarily have access to testing.
That's exactly right, and we're being really careful about how we approach this. We know that we have a community in Park City, in particular, where people are living in very close conditions in some of the affordable housing units that are just outside of Park City, actually close to where our hospital is located. And a lot of the people that live there are hospitality workers and others involved with the tourism industry there in Park City. And there's been some significant exposure to COVID-19 and just the way that people live. It's really hard to socially distance in that community. And so we'll be taking the mobile RV and some of our caregivers up to Park City tomorrow and Saturday to do that testing. And we're doing it in partnership with the local community. We want to, as much as possible, engender trust that we're here to help, not that we're not creating anything that's a scary environment for anyone. So we're really taking guidance and lead from our partners like People's Health Clinic that serve that community every day, and going into the school as a setting for doing that so that we can create as much trust as possible.
So you talked a little bit about community partnerships. We're also doing one with the University of Utah Health up in Park City. It's a joint COVID-19 testing site. How does aligning our services during this pandemic help keep people safe?
You know, I think it's so important that we present a united front from a healthcare perspective to our community. This is a scary time for all of us in different ways. And our community looks to its healthcare experts to be a source of truth around issues like this epidemic. And it's been really important that we're saying the same thing to the community about what they need to be doing to keep themselves safe, when they should get tested, where they should go to get tested. And so we've made a lot of effort to ensure that we're coordinating. I'm talking with people from the University of Utah multiple times a day, and so are other colleagues around Intermountain to ensure that we're coordinated. And because Intermountain and the University of Utah were the two organizations to stand up community testing right away, one of the first things we were talking about was testing. Where are we standing up sites? Whom are we testing? How are we supporting our caregivers so that they're safe and able to meet the needs of the community? And one of the first realizations we had was both of us felt a need to be in Summit County. We both have clinics in that community, have caregivers in that community, felt a need to provide services there. And Intermountain had a testing site up and running for several days already when we heard that news that the university wanted to do the same. So we said, let's do this together. And I really applaud our caregivers and our leaders for figuring out how to share best practices, design a testing site at the ice rink there in Summit County that has University and Intermountain logos, University and Intermountain caregivers, and a process that ensures that we're able to meet the entire community's need. It's been really cool.
Yeah, this isn't a competition, which I think is something very important for people to understand, is it's not one healthcare system against the other. This is a worldwide problem. So I think it's great to see that we can play nice together and make sure that we're working to serve the best for our communities. So Intermountain is also coordinating care in all of the communities it serves. How do you balance the competing priorities throughout such a large geographic area?
You know, it really is just part of the way we always operate, to ensure that we're listening to the needs of different communities with an ear for what's happening in each setting and how Intermountain can be responsive to those varying needs. We're fortunate that we have Intermountain has facilities, caregivers, leaders, and a community health individual in most of our communities. So we have partnerships with all of the low-income community organizations, the federally qualified health centers, the homeless shelters in those communities, the mental health providers that serve every community across our state. So we've been able to ensure that we're listening to what are those needs across, whether it's in St. George to Burley, Idaho. What are the needs of our community and how do we respond to those? Sometimes we can respond with a statewide response and do that in coordination with our partners at the state or other organizations that reach statewide. And sometimes we can be very specific in our response. So I'll share just a couple of examples. As we began to work on serving the homeless community, Salt Lake County was the first to be responsive in terms of creating guidelines for how we discharge patients from our hospitals, and then how do our homeless service partners receive them in the community. But very quickly, we were having we had a homeless individual in Weber County that we were treating at McKay Hospital and needed to have a plan. So we connected with the health department in Weber Morgan County, connected with the homeless shelter at Lantern House in Ogden, and we're able to get our colleagues at Salt Lake County to share what they had done with those partners in Ogden. That led to statewide dissemination of what Salt Lake County had done, and we were able to share it with all the homeless resource providers across the state. Now, we still need to be responsive to what do those local communities need and how do they want to manage the process in their community, but we're also able to learn from one another and bring resources from one community to another, which has been really valuable.
That's awesome. Switching gears a little bit, Primary Children's Hospital has seen a drastic reduction in RSV cases and regular flu cases this year. A lot of people are crediting this decrease due to hygiene and hand washing. When COVID-19 restrictions are lifted, what is your hope that we've learned from this? What can we take into our new normal with everything we've learned?
Every good crisis has some wonderful opportunities for a community to do certain things better. And I think COVID-19 will present for us some silver linings in this experience that I hope help us do a better job improving our community's health. Our community health priorities as an organization are to improve mental health and well-being and see improvements in air quality and address preventable disease, which when you look at what we're learning from our COVID-19 experience, we are learning things that we've always known to be good health things are actually saving lives right now. Washing hands, not shaking hands, distancing from one another when we're sick. These practices we should take we should be much better in the future about holding one another accountable when we're sick to not go to work and stay home. Maybe we won't shake hands as readily either. And I hope we'll all wash our hands for a lot longer. We've also learned that we can get a lot done without driving around. Before we started the interview, we were talking about how you and I are walking everywhere now. We're walking to get our groceries. We're walking because it's good for our physical health to get out and take a break from our work and what we're doing. But that's also really good for our mental health and well-being. It's good for our physical health, and it's really good for our air quality. I hope that we can have some long-standing habits come out of this. We're also learning how much we really value a vaccine. right? We can't wait until we have a COVID-19 vaccine. Well, today we have vaccines that can help prevent flu, keep us from getting certain cancers and measles and mumps and other diseases. I hope that we will be smarter as a community about how we can use vaccines to keep us healthy in a lot of different ways. I also just love the way that we're collaborating. We're getting a lot of things done that have been hard to get done before. And that has we've forged new partnerships, and we've been able to get some things done, like get an emotional support line up for our communities, get healthcare at home, transition to telehealth for a lot of the care that we can do remotely. And I hope so many of those things stick with us because they improve the affordability of healthcare and improve health.
Yeah, there's a saying that I don't quite know the words about, but that it takes some sort of big event to kind of kick people into high gear to figure out what they can really do and how to work together. So it's unfortunate that this is happening, but there's some great stuff coming out of it, it seems like, which is awesome. I've also noticed that when I'm exercising, walking in my neighborhood, that people are waving and smiling at me now, which was not something happening 6 weeks ago. It almost feels like people are thinking we're all in this together now. Do you think that this is here to stay?
Gosh, I hope so. I really hope so. I think, as I mentioned that, of course, our number one priority is improving mental health and well-being in our communities. And I really worry about the impact of COVID-19 on our mental health and well-being. And yet I think that there's a realization going on right now where people are valuing the connection, human being to human being, in a different way than we did prior to this incident. We're all yearning to be with one another again, rather than 6 feet apart or working from home. And I think it's giving us an appreciation for, yes, all of these mechanisms we have to communicate with one another through social media, through WebEx and video communication are great, but nothing replaces the human-to-human connection. And I think we're gonna value that differently and realize that none of us are invincible from COVID-19. None of us.
Yeah, that's really true. I think that connection is something that I know I personally miss, and it's hard to not hug your parents every day or engage with the people you normally do, but it's for the well-being of our state and our country. So, Mikelle, thank you so much for joining us. We really appreciate the time you took with us today. And if you guys are experiencing mild to moderate symptoms of COVID-19 and would like to speak to someone, you can call our COVID-19 hotline at 844-442-5224. We also have the Emotional Health Relief Hotline available 7 days a week from 10 a.m. to 10 p.m. And that phone number is 833-442-2211. Thank you so much, everyone. Stay home, stay safe.